Welcome to Behind the Screen, a podcast series from BreastScreen Victoria. I'm your host, Dee Mason, and in this episode, we're setting the foundation for this entire podcast series by asking a simple but critical question. Why does breast screening matter so much? I'm going to be joined by three voices who sit at the heart of this work. Rita Butera is the CEO at BreastScreen Victoria. She'll take us inside the program, its purpose, its reach across the state, and the ultimate vision towards no deaths from breast cancer in Victoria through early detection. Breast surgeon and state clinical director at BreastScreen Victoria, Dr. David Speakman, will explain what the data really tells us about breast cancer, why screening saves lives, and how finding cancer early changes both survival and quality of life. And Sue Viney, a long-standing consumer representative, brings the lived experience, why women do and don't attend screenings, what happens if you call back, and why the consumer voice matters. Together, we're going to unpack the facts, the processes, and the reason early detection makes such a difference. This is Behind the Screen, Episode 1, The Importance of Breast Screening. Rita Butera, Dr. David Speakman, Sue Viney, thanks so much for your time and welcome to Behind the Screen. I'd like to start with a big question for you, Rita, right up front. BreastScreen Victoria's ultimate goal is towards no deaths from breast cancer in Victoria. Is that a goal you inherited, or has it always been baseline, the goal of BreastScreen Victoria since the beginning?
Absolutely, but also to reduce the impact of breast cancer on the lives of women who have breast cancer.
Is that too lofty a goal for an organisation that doesn't involve itself in the treatment of breast cancer?
Well, I think it's important to think of the whole picture. Our role is screening, and that's about early detection. And so if you really want to impact a really big problem that we have in our country or in our state, you need to look at what are we doing in prevention, what are we doing to detect something early so that we can improve the outcome, but also, as well as that, what are the services and the treatments that we have? So we're a part of the whole system, and it's the whole system working together that's going to make the difference.
Dr. David Speakman, or David, if I can call you that.
Please.
Can you outline for me what you think the key statistics around breast cancer in Victoria, or in Australia if you'd rather, are at the moment? What are the things that jump out at you as being the big issues?
In terms of breast cancer, there are about 5,000 women in Victoria who will get breast cancer every year.
Ooh.
So that's too many. So prevention is important, but then early detection is equally so when you know you can't prevent it all straight away. And so there is little doubt that women who have their breast cancer detected through a breast screening program do better. And by that I mean fewer of them die, fewer of them progress to terrible disease. The treatments they need are less invasive, less impactful on their quality of life. And so that's what we're aiming for out of the screening program.
What about you, Sue Viney? What's a statistic that jumps out at you around breast cancer in Victoria at the moment?
Well, it's the most commonly diagnosed cancer among Victorian women. It's bit over 13% of all cancers that are diagnosed with women are breast cancer. And the median age is 61, so half the women are younger than 61 and half are older.
1 in 7 women will be diagnosed with breast cancer. So that's quite significant.
If you look at all cancers, the rate of breast cancer is the highest. It's the league ladder leader for cancers in women.
Trust a fella to bring league leadership into the leaderboard. So breast cancer's on the leaderboard, and yet
It's the top of the leaderboard.
it's the top of the leaderboard, but in terms of mortality,
It's plummeting,
great.
which is fantastic, isn't
It's
it?
a win.
That's a win for screening, but a win for better treatment at the other end. And
Yeah.
it's a combination of those two things that's driving mortality down.
Yeah.
I think if you're diagnosed with breast cancer in the state of Victoria today, and we're looking at all comers, so all stages, upwards of 90% of women are alive and well in 5 years, 10 years, 15 years.
In terms of diagnosis and success, a successful outcome, why is 5 years a critical time?
I think it's a great thing to talk about because we've measured things at 5 years, because for a long time we've known in medicine that if you're where you're at 5 years, pretty much parallels where you'll be at 10 and 15, 20 years most of the time. So it's a reasonably close time to diagnosis to be able to give some sort of outcome data that might apply for the rest of your life. But actually, if you looked at some types of breast cancer, we could tell you where you're going after only a couple of years.
Do you think, David Speakman, that there is a higher incidence of breast cancer or just a higher reporting of it?
I think it's a little bit of both. Definitely higher reporting. If you look back to the time you're quoting, our ability to get information about what was happening to women across the country was way lower than it is now. And that's a great job by the government to be on top of that. And then I think if you look actually from the Cancer Council Victoria, incidence rates over the last 20 to 30 years, they're creeping up, but they're not skyrocketing up.
So we're detecting more cancer, but we're treating it better, or we've got better results. And that is partly due, of course, to screening.
It's due to the whole team of people who look
because
after patients with breast cancer.
Yep.
I think it's really important to acknowledge that it's like 50% reduction in mortality rate. That's extraordinary since the beginning of the program. So you could imagine if the program didn't exist.
So what are the main things that contribute to the likelihood of a breast cancer diagnosis?
There's a real mix of factors, some of which we understand really well and some which we don't. Some of those are lifestyle and modifiable, so things like smoking, obesity, high levels of alcohol consumption, low levels of physical activity, we know are modifiable factors. At the same time, women who are, non-alcohol drinkers, non-smokers, very fit and healthy people can still get breast cancer. Some of that is genetic, so there are some genes that have a really strong indicator of future development of breast cancer. But I guess it's true to say that there is still a lot that we just don't understand, and the more the research goes on, the more complex the picture of what breast cancer becomes.
If you, Dr. David Speakman, had to advise a woman of, say, 56, the best way to live to minimise their chances of developing a breast cancer, what do you think you would advise?
I think lifestyle factors is the thing you can change, and I think physical activity, and it's not necessarily going to the gym, it's actually just getting out and walking. Some of us will be old enough to remember Life Be In It, Norm. It was a very prescient campaign because if you're out walking every day, you're actually doing yourself a big favour, both in terms of decreasing your cancer risk, and that's breast cancer, but all sorts of other cancers, but you're also improving your cardiovascular health, your respiratory health, a whole lot of things. You're decreasing your chance of getting diabetes. So if I could give a single prescription, it'd be get off your backside and go do some walking. And then the other thing is think about what you put in your mouth, what your diet's like. We're learning more and more about things that are healthy for you, help your microbiome, actually help you fight cancer. So that stuff will develop as we go forward and sort of lift the lid on what we can do in that respect.
Sorry, Rita, you had something you wanted to add there?
I think the point just on prevalence, which is really important, is that being a woman and ageing are the major risk factors that
Which
you can't
is so
modify.
Unfair.
Yeah, very unfair.
It's so unfair.
So they're the non-modifiable risks, and they are the greatest risks. So,
do we put our arms up and go, well, what am I going to do? Which is what they did in the 70s. I know my grandmother had breast cancer, and it was a terrible outcome for her. And there was no question that she was not living the lifestyle that she should have been living. But it was considered a genetic lottery that we've got bad genes.
Yeah, but the modifiable risks are really important as well, and so you can't discount those. But in addition to that, that's why finding something early when it's small is really important.
It's the highest diagnosed cancer in women, but it's not the biggest killer, which means that it has good outcomes. What causes a good outcome in breast cancer?
Finding it early. So if you find it when it's small, the average size of a cancer detected in the screening program is 15 millimetres. So that's small by breast cancer standards, and that means that you can have treatment that's highly effective and go forward living a normal, or at least as normal as possible, life, certainly a fulfilling, enjoyable, happy life, doing the stuff you want to do. And if we're going to treat a cancer, that's the aim of the exercise. First, you want to live, no problem. But you want to live a good quality of life. That's what we're after. And so finding these cancers earlier means not just better mortality figures, but better quality of life, more productive people actually doing what they want to do.
And people who seem, in my experience, post breast cancer to be just loving life. Like there seems to be a real vim and a vigour, and that's what I've found in the breast cancer community.
It's just quite extraordinary. I think that's what makes it quite unique as well, the number of women that want to stay involved with the program. We've got like over 6,000 or so consumers involved in our network. And there's this real kind of commitment to being a part of the solution and sharing the story and sharing the message as well about the impacts and how early detection helped them. So it's really a positive experience as well. And there's a real love for the brand. There's a real love for the service.
Sue Viney, we know that early detection is the critical thing in having a good result. What are the different ways that we can be diagnosed with breast cancer? Because it's not just mammogram. Some people go through other paths.
The service that BreastScreen Victoria offers is really best for women who don't have any symptoms. Some women do detect symptoms, and so their best pathway is to go through a diagnostic stream, which would be probably a mammogram, ultrasound, clinical exam by their GP. That's another way of women finding breast cancer.
I know that when I was a younger woman, it was all about self-examination. We were all taught to do self-exam, I guess, and then report to a GP with issues.
Absolutely important to notice changes in your breasts. So it might not be something that's particularly stands out, but it might be just something that looks a little bit different. And so that's where the GP is really important to then have a look with professional eyes and go normal, or we think we need to do a little bit more about that.
Now, we know that there's a high rate of breast cancer in the community. Rita, how do we know that screening is the way to ensure early detection of these cancers and therefore promote a better outcome for these women?
To give some context, BreastScreen Victoria is part of a national program, BreastScreen Australia. So every jurisdiction in the country runs the program. Now, with a prevalence rate of around 1 in 7 women who may get breast cancer in their lifetime, that's a really high prevalence. And so a population screening program is really evidence-based. And so the investment in screening really pays off in terms of the reduction and the impact it has on women's lives and on the health service system as well.
Before we had BreastScreen Victoria, we'll ask you, David, what were women doing? Were they just leaving it to stage 4 and then presenting and dying?
That's right. My grandmother actually passed away from breast cancer. She didn't know she had it till it was already stage 4. She got sick, walked into the hospital, the GP one day, and he put her straight into the hospital, and she never left.
So, Rita, was that the impetus? Was it that women were walking into GPs?
Absolutely, yeah. And that's why it was so important to look at what can we do and how can we detect in a population of women in Australia, older women, and where is the most risk. So the program is really designed to intervene where the risk is highest, and that is from the 50 to 74 age group.
So I know that that's where the diagnosis is the highest, but people will often be saying to you, but women between 40 and 50 also get breast cancer. That's not our target group, but we still accommodate them?
Absolutely. So if you're between 50 and 74, we will invite you to come to BreastScreen for a screen every 2 years. But if you are 40, you are welcome to come, make an appointment, and we will provide the same service. It's not easy for a lot of people to go into a clinic, take off your top and get a mammogram. It can be quite confronting and it can be quite difficult to do that. But it's free, it takes 10 minutes, and most women who do it say, why didn't I do it ages ago?
Exactly. So what do you think are the key drivers? Why are women not taking up this offer? There's got to be some elements of fear. There must be some misinformation if what Rita is saying is once women have a screen, why didn't I do it earlier? What do you think?
I think there's a lot of view that maybe it's going to be painful, and so there's a lot of social media cartoons and things like that about women having their breasts flattened. There's also access issues, and that is both women who are now working, we're working much later in life, actually getting to a screening place, personal views about health and how active people want to be in their health, and also, perceptions of barriers. Am I going to be welcome? And I think the work that BreastScreen Victoria has particularly done about establishing every screening site as being welcoming and friendly for people with breasts to go along to is really important. But we know, for instance, Aboriginal women find it difficult to find time to get access, to be comfortable with taking their tops off. And again, that's an area that BreastScreen Victoria has done a lot of work on, understanding from those women about what their issues are and then making spaces that are friendly and accommodating and welcoming.
We're going to be digging a little bit later in this podcast series into hard-to-reach communities and really focusing in on the Beautiful Shawl project, which is an extraordinary win for BreastScreen Victoria, and we'll be talking with Auntie Jill Gallagher about that a bit later in the series. But I want to dig in now to a bit more about how you apply the service, Rita, throughout Victoria. You've got a lot of women, a lot of breasts in Victoria. We want to see them all. How are we going about it?
So to be able to do more screens, we have to have a lot more clinics out there. So we've got over 50 clinics across the whole state. We've been really fortunate to be able to open a whole lot of new ones, particularly in rural, remote areas. But as well as that, we have 2 mobile vans which go around and visit some of the more remote rural areas every 2 years. And they are very, very popular.
They are popular, but not just popular, but iconic. They are a bright pink bus, and I'm sure if they're parked in your regional area, you will know all about it. And if you want to know about it before it gets to you, you can check out breastscreen.org.au/locations, and you can see where the buses named Nina and Marjorie are headed next. But say I've got to go to a clinic and get my BreastScreen. I've booked it online or by calling the number. I get in there. What can I expect from my BreastScreen?
What will happen is you've made an appointment, we've told you where to go, you receive information about that, and you attend your appointment. So there's usually a receptionist at the screening site. We would like to think that it's a very welcoming physical environment as well. It can vary, of course, from area to area, but we're working really hard to kind of improve that. And what happens then is you're led into a room where there's a mammo machine and a radiographer, and they will talk to you. You could be offered a gown if that makes you feel a bit more comfortable.
Well, how much of my body do I need to expose?
It's really just the top part, so just the top.
Bras off.
Bras off, absolutely. And so it's a woman radiographer, and I think it's important to make that comment that it is always a woman providing that treatment. And so what happens is the radiographer takes 2 images of each breast, and it's quite extraordinary. They're very experienced, they know what they're doing, and it does literally take 10 minutes. Those images are then read by a radiologist, and that radiologist will then make an assessment, and it's probably in around 5% of the cases, it may not be it may be hard to read, and about 5% of the women who do screen might be called back for some additional tests.
95% of people that go for a mammogram are in the clear.
Absolutely.
Well, in the clear. Nothing's detectable in that.
Not detected.
So 2 radiologists look at every mammogram that gets done.
Okay.
And so it's not just one person clearing you saying it's all right. There's 2 very experienced people doing that. Radiographer's the wonderful person who takes the mammogram, as we were talking about, who actually manipulates your breast around in the machine. The radiologist is the person in the dark room in the back who reads it and says, is there a problem, yes or no?
So they make an assessment, then we type them up a letter and we send one to the doctor and to the woman?
Exactly. One goes off to your GP saying your patient just had their mammogram, it's all clear, and one goes to the patient and that says hopefully it's all clear, and as we said, that'll be about 95% of people who get their mammogram get a all clear letter, and these days they also get a note in that about what their breast density is.
Yes, breast density reporting is a big topic of discussion around the breast screening world at the moment, and we'll be delving into that more in episode 5 on innovation here on Behind the Screen. But some people don't get that letter, do they, Sue Viney? Some people get a call back. Tell us what that is and what can we expect if we get one?
Well, it's always by phone. If somebody is called back for whatever reason, that might be that something's been detected, or possibly just that the film's not quite of the quality that is required to be absolutely sure. Then an appointment is made at an assessment clinic. Maybe there'll be a decision that it's fine, that there's no abnormality there, or there may be some more tests that are required, and they may be done on the day, or it's possible that a woman might come back, and then the woman will be told what the outcome is. If it's cancer, then they are immediately referred into a nurse who'll sit with them and say, what is it that you've understood? Because most of us would just hear cancer and not hear anything else. And then they're linked in via their GP, or BreastScreen Victoria helps them to link in to appropriate treatments.
BreastScreen Victoria invites women and trans and gender diverse people aged from 50 to 74 without breast symptoms to have a free 10-minute breast screen every 2 years. Breast screens with us are performed by a woman radiographer and don't require a doctor's referral. With over 50 clinics and 2 mobile screening services across the state, you can choose a clinic and a time that's convenient for you. Book at breastscreen.org.au or call 13 20 50. So how does BreastScreen Victoria sensitively end that relationship with the consumer? So Rita, what's the ongoing association, or how do we handle that transition?
In most of the assessment services, there are links to services in the hospital system or in the acute system where women can be referred, or a GP. The woman may prefer to see a GP and get a referral from her GP to follow up for treatment.
Are you ever in those meetings, David?
I was doing those meetings all this morning, actually.
Oh, mate.
That's all
Does
right.
it get any easier?
No, I'm very lucky. It's interesting. People think saying to a lady, you've got breast cancer, is terrible. But actually, I'm privileged to meet some amazingly courageous women. And it's generally, to be honest, just a very uplifting experience watching people take this sort of news and what they do with it and how we can help them. And so I try to stress when we're in those meetings, if it's possible, to say, look, the good thing about coming through screening is we've found this when it's nice and early, and you're going to see your children grow up or your grandchildren grow up or whatever it might be, or get, because I think usually when you break this sort of news to people, a lot of what goes through their head is not at all what the doctors might be thinking about, how can I treat this, or what wonderful procedure can I do, or what great drug can we use. It's what am I going to do about the kids, or what am I going to do about the mortgage, or what am I going to do about the fact my husband's got a disability as well, and now I've got trouble. How is all that going to work out? And I think it's putting it into perspective about that if you find it early, actually you're going to be able to manage all that. You're going to be able to go forward, and that there is light, if you like, at the end of that tunnel.
Rita mentioned earlier, of course, that all women over the age of 40 are eligible to have a breast screen through BreastScreen Victoria, but that BreastScreen Victoria invites women on the Victorian electoral roll aged from 50 to 74 every second year for a screening through the mail. Now, we know that they're not responding or participating in the screening program at the rate that we want them to in order to ensure consistent early detection. So, Sue Viney, what do you think are the key reasons we're not getting the participation rate that we need?
I think there's a couple of things. One is you get the letter and you think, yeah, I must get around to that, and then it falls down to the bottom of the back of the drawer, or you think, yeah, I must do that today, I must do it. And then it slips off the radar. So I think there is a bit of inertia, and probably the electoral roll is not the best way of contacting women, and, that's being looked at as well. I think it's quite hard to reach some groups with the written word. So we have success when we're going out to events, shopping centres, community groups, and talking face to face. So some people like to hear things, some people like to read things, some people get their information through social media. So there's a whole lot of ways that people commit to screening. And I think one of the things about our health, that as women, it's easy to say, yes, I can do that next week. So for me, the advent of the online booking service has been a game changer. So it's much easier for me to log on when it's convenient and actually make an appointment when it's convenient to me.
Rita, what are your thoughts about why we're not reaching all the women? I know we're doing an amazing job, but why aren't we reaching the numbers of women that we want to reach? to access the program?
Well, it could be a combination of things. It could be lifestyle, it could be family commitments, it could be work commitments.
Fear?
It could be fear of not wanting to know. Avoidance is also something that we're aware of. Of all the letters that we send out, about half of them will eventually make an appointment, which kind of is aligned to around the 50% participation rate at the moment. And so we're always looking at how do we change that. With the population ageing into the program being more digitally aware, what opportunity is there for us to do things better, smarter, more efficiently to get that sort of engagement? There's been a real shift in the online booking as women have aged into the program. I think for the younger cohort, it's going up to around 60+% booking online, which is quite extraordinary because we had targets of trying to get to 50 a little while ago, and it's just jumping. So it really demonstrates that people are actually responding to that digital improvement.
Are we being too gently with marketing? Why is breast cancer one of the few cancers that doesn't use a scare campaign? I don't want to scare women, but if we're not getting the boobs on the block, as it were, why is the messaging not working?
Well, I would probably disagree a little bit because I think the message is working for a lot of people, but it's not working for some. Mm-hmm. So it's about maybe us understanding why isn't it working for some and how can we improve our messaging for some people to get them engaged. And I think that's the work we've got to do.
To be fair, the 50% who aren't taking up might be getting their breast health looked after in some other way. They might be going private, they might be dealing directly with their GP who they trust and they're taking advice there, or they might have some alternative way of dealing.
Yeah, I think what you've hit on in our discussion, which I think will run through your whole podcast, is that we can't, in any screening program, take a one-size-fits-all approach. And I think we'll hear that, as I said, through other elements of screening, but particularly in participation. And the client contact team at BreastScreen who do all this work and do an amazing job at all those sort of different communities they have to approach, I think that's right. They're tailoring the message depending on what the needs and the demographic of the group they're looking at, and that's how we have to do it. And when screening started back in the early 1990s, it was, by the nature of the program, it was you get the letter and that's it. And now I think we're finally starting to go, actually, we need to treat people with a bit more nuance. We talk about the digital stuff. So it's absolutely true that a demographic, I don't think we actually know who they are very digitally literate. I think there are some 80-year-olds who are highly digitally literate who want their invitation, by an SMS or what. But there are other people who want still the letter. And how do we find out what the way it is you want the invitation to come?
It's about really understanding the culture of it. So we're going to be talking about hard-to-reach communities, about how giving messages in language and about how calling people rather than getting a letter does help. So you're right. I like the fact that we've done a scattergun approach, which is here's a letter for everybody, and now we're going to find the nuance and hone it.
And I just wanted to say something else. Data is data. So it's how do you look at the data and what story does it tell? And we know that actually it's close to 60% of women who are invited stay engaged with the program. It's the 51 who will come within the 2-year period, but some people might take a bit longer, but they come back.
The three of you here, Rita, David and Sue, you're leaders in your field. You're leaders in the part of the sector of the industry that you're working in. How do you ensure the culture of an empathetic organisation, of a humane and kind organisation, when it's so data-driven? There's so much data that drives your policy as well as your decision-making.
Never seen so much data as I have at BreastScreen Victoria. But I think the thing to remember is that it started 30 years ago, and there's a lot of people who were involved in the program 30 years ago that are still there. Now, they're there because they're really passionate about what they do and they love their work. And finding cancer early for women is what really drives them. You've got a really values-driven organisation. People in it love it and enjoy it and they like to stay. And I think it was just extraordinary to see that level of commitment and passion and enjoyment, but also knowing it's a hard space because we go on about throughput, more in less time, and that's hard. But I've just been really quite amazed at the compassion that's there, the care that's there, the commitment, the dedication to the cause.
So you would have an idea from a consumer network point of view, why are so many women who are free of breast cancer, who have been diagnosed through the program, had their treatment and moved on with their lives, why are they so passionate about still being involved with BreastScreen Victoria?
Right from the beginning, right from the early 90s, BreastScreen Victoria has engaged with the people using the services. I've been around for about 20 years, initially out of my local screening service, and I think that's where I saw what an impact the consumer voice could have about the way that, say, assessment clinics are set up so that they are more welcoming, friendly and a little bit less scary. And that involvement and ability to provide advice all the way through the organisation I think is really important, and women can see the value of that, so they're happy to stay around.
David, for most of us, the only time we interact with the medical profession is when we have an ache or pain and we have to see our GP. I am imagining every time somebody interacts with medicine, it's an opportunity for us to spread the message of the importance of breast screening. Tell me, what do you think the role of the general practitioner is within the breast screen program?
GP is a critical part of the health system, underestimated, overwhelmed, and often asked to do everything. Because if you think about it, everyone thinks, the GP should do this, 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 this. And it's great. Lots of them have software to go, beauty, I've ticked off that this lady like yourself is going off the breast screen regularly. I don't need to worry about that anymore. But it's a hard ask, as you said, because so much is going on. So I think we're talking about we take different approaches to how we invite patients. I think we actually have to have a much bigger array of how we have GPs access information about screening and everything else. And are there ways we can electronically prompt them? We were talking briefly about breast density, and so actually in the letters we send about breast density now, there's a hyperlink in the letter, the electronic letter for the GP. So if they want to know, brush up on breast density or get all the key facts in 10 seconds, hit the link, bang. Because that's how they work generally. I'm in the clinic with a patient. I need to know right now, this is the next 3 things I have to do. Boom, boom, boom.
Rita, I took a look at your annual report from last year and I can see that you're tracking well in terms of setting your KPIs and knocking it out of the park. What are some of the key statistics or the key indicators that the program is travelling in the right direction towards that ultimate goal?
Well, we at BreastScreen Victoria are doing now close to around 300,000 screens per year, which is quite significant. It's ramped up quite a bit.
And you're screening at approximately 50%. So can we do 600,000? Have we got the capacity, or do we need to grow with the dream?
Got to grow with the dream, and it needs the resources to grow with that dream.
So, and this is when you're talking about it being such a data-driven business, you've got to prove we're scanning this many and we're getting this much result and get refunded so that we can open more clinics and get more buses. So that's the cycle of it. That's why you're dealing with data every day. You've got to say, I'm getting
evidence.
These numbers.
Yep.
Okay, but the numbers are good and you're happy with the way the program's progressing?
Absolutely. And governments don't invest unless there's evidence to show that there's a return on that investment. And I think that's what we've got to continue to show.
What's your proudest achievement in the last 3 years at BreastScreen Victoria?
Record number of screens. Record number ever. So every year we increase screening. And so, an extra 8,000 to 9,000 screens every year on top of what we screened last time within our current capacity. And that's been extraordinary.
Are you screening above the rate of growth in the cohort? Because I think we're ageing so rapidly, aren't we?
We are ageing rapidly, and we've got to increase a good 8,000 a year just to keep up with the growth. So participation rate might stay a little bit the same, but the volume that's going through is more.
And of course, if the participation rate starts to grow exponentially and you're up around 80% participation, then we'll just have to grow the service to meet demand, because that's exactly what we want. More women screening, resulting in earlier detection, pushing us all towards that ultimate goal of no breast cancer deaths in Victoria. Now, before I let you all go, I've compiled a list of frequently asked questions and or myths about breast screening. Let's go rapid fire, answer these. Starting with, I've heard that it really, really hurts.
I think it's uncomfortable for some women. Sometimes it's uncomfortable for me. Sometimes I think you kind of put any compression on it at all.
I have small breasts and so I don't need a mammogram.
If you have any breast tissue at all, you can be scanned.
Can I get a screen if I'm not in the target group, say I'm 35 years of age?
No, because mammograms aren't the best test for a woman who's 35.
We would refer you to your GP if you've got any concerns or you want to screen.
42?
Absolutely, you're eligible to come to BreastScreen for a free screen.
76.
Absolutely eligible to come and get a free screen.
Okay, but why am I not getting a letter anymore?
There's so many compounding issues as we get older. You may not be invited to come back after you're 74, but you are most welcome to make an appointment.
David, I got the all clear on my mammogram, but the letter says I have a breast density of C. Do I need to do anything or can I wait 2 years?
No, you can wait 2 years. Most women with breast density C, their cancer will be picked up on a standard screening mammogram, and doing an extra mammogram at that time for most women is unnecessary and extra radiation.
Do I need to go every 2 years if I've already got the all clear 2 years ago?
Yes, because breast cancers can develop in that intervening period. So important to keep it every 2 years.
Can they see cancer through my breast implant?
Yes, it is important to get a breast screen even with implants, and cancer can be seen.
In fact, there's a great study done in Victoria of all women screened who had breast implants. Of all those ladies who had breast cancer, the screening mammogram picked them all. So the implants did not mask anything. And that's a credit to the great radiographers who get an excellent picture.
I'm not enrolled to vote in Australia. I'm not a citizen, so I don't get an invitation letter. Am I still eligible?
Absolutely, and it's not good enough that you don't get invited. So we are looking now at how we get data from Medicare so that we can make sure we invite you.
I self-examine my breasts, but I don't feel any lumps. Does that mean I don't have cancer?
No. The beauty of going to BreastScreen is early detection of breast cancers that are not able to be felt. So they can be right deeply into your breast tissue. You may not be able to feel them.
I don't want any of my information being made public.
We have a major commitment to privacy, and we are also regulated under the Privacy Act with regards to all the health data, and cybersecurity is front and centre.
I don't want to get my screen done now because I haven't sorted out my private health insurance and I don't want to have a pre-existing condition on my record.
Isn't it lucky that you live in the state of Victoria? Because we've got an amazing public health system. So even if you didn't access the private system, in Victoria we are incredibly lucky. The breast units we have around here, you are getting the world-class care. It will be equally as good as anything you get in private, and it costs you nothing.
I think that is such a great point to end this podcast on. But can I just ask each of you, what's the one thing that you would say to a woman who is yet to get a breast screen or who is umming and ahhing about whether or not she needs to or has it in her to go and get a breast screen done? What's the one bit of advice that you would give? My
message to them is, what are you scared of? If you find cancer early, your ability to treat it is just extraordinary in the state of Victoria, and your survival rate is increased significantly.
I'd say, what are you waiting for? I'll come with you. Then I'd say, if I was into scare campaigns, I'd say, if you want to make sure you see your kids grow up and see your grandchildren come into the world and play with them and look after them, then why on earth aren't you going to have a breast screen?
You're worth it. Your health is worth it. Your lifestyle's worth it. It's a very easy thing to do, and it can make such a difference to your life. Big thanks to my guest today, to Rita Butera, CEO of BreastScreen Victoria, Dr. David Speakman, State Clinical Director at BreastScreen Victoria, and Sue Viney from BreastScreen Victoria's Consumer Advisory Group. Behind the Screen is available on podcast platforms and via breastScreen.org.au/podcast from February 2026. Come and join the conversation on Instagram and Facebook. Make sure to like, follow and subscribe so you'll be notified weekly when the episodes drop. And if you know someone who's curious about breast screening or could really benefit from these conversations, please feel free to share.
Thanks for listening, and please tune in for the next episode of Behind the Screen, where Dr. Speakman will be coming back to the panel along with Catherine Langford, BreastScreen Victoria's Director of Quality and Clinical Care, and Liz Naval, a member of the BreastScreen Victoria Consumer Network, who was diagnosed with breast cancer through the screening program. That's coming up on Behind the Screen, Episode 2, The Assessment Journey.